Okay, Dr. Abhishek, namaste.
Namaste, sir.
Hello, hello.
Hello.
Welcome to our office.
Thank you so much, doctor.
So, just for the sake of the our team, I would like to introduce you.
Sure.
Team, this is Dr. Abhishek, and he has come over to our office to just to meet us and to know about our organization. And he called me briefly a week ago to asking for support to set up an ICU in his hospital. So we are recording this as a training purpose. So let us go through the flow and then get information from the doctor and then see how we can help the doctor. So sir, for the sake of our team, we would like to record this, of course.
Sure, sir. Sure.
We have taken your permission for that, and thank you so much for that. And sir, you told me that you have got a hospital.
Yes, sir.
And I will not reveal the name of the hospital and the place, don't worry. And but we need some information from the hospital.
Definitely.
So, sir, I will be asking some questions from you to get some information before I can suggest you in what way we can help you.
Definitely.
So, so how many bedded hospital is yours?
See, right now we are 30-bedded hospital. We are planning to increase it to 40 in some time.
Right. Okay.
So we are there in it's about 10 years now.
Oh, very good.
Yes.
So, you have been there in the hospital for 10 years.
Yes. Yes.
And you are a surgeon.
Yes, I'm a surgeon. My wife, she is a gynecologist. So we both work together in the hospital.
Great, sir. Great. So, few finer details I would like to ask you, sir.
Yes, sir.
So, you said that you have a 30-bedded hospital, and do you have approximately 50% occupancy in your hospital?
Yes, sir. Yes, we are in a rural area. Yes, definitely emergency cases come. So yes, 50% all the time it will be there.
What?
Yes. Yes.
So far you have never tried ICU?
No, sir. Actually, we haven't tried, but we had consultants coming in. But sometimes what happens, they will be there and then they leave the hospital. Okay. So that is the main problem. So right now, we refer it to somebody else.
So you tried setting up an ICU and doctors come, but then after some time they leave.
Yes.
So that's your main problem.
Yes, that is the main problem.
Good. So 10 years of hospital, husband is surgeon, wife is a gynecologist, you have good practice, always 50% of the hospital is full all the time. You tried for an ICU and somehow it didn't work out.
Yes.
That's why you are here.
Definitely.
Right. Wonderful. So, sir, how many patients come to your hospital seeking for emergency and you end up referring them? Can you give me a number roughly per week? How many?
Per week, I would say approximately around 7 to 10. Let's keep it.
Big number. Okay, good. So, which means that on an average, every day you are referring one patient
Yes.
to some other place.
Yes.
So, this some other place, how far is it from your place?
It is about the nearest hospital, where they have ICU, is about 50 kilometers.
Nearby
They have to
city.
travel. Yes, nearby city they have to go.
They have to go, and 50 kilometers means approximately will it take 45 to 50 minutes?
Yes, it's about an hour.
Or 1 hour journey
Yes.
for patients to go there.
Yes.
Good. Now, these patients whom you are referring out, when they go to city, what is the per day cost of ICU in that city?
It depends, but whatever I heard from the patients, when they come back, they normally say 80,000, 90,000 per day they spend it.
Okay. So that includes probably pharmacy and other things.
Yes.
I will take it as 50,000 for example. Even if I say 50,000 average billing of the patient, and approximately 2 days is what they stay, no?
Yes.
2 days,
Yes.
approximately in ICU.
Approximately.
Even if I say 2 days. So according to you, sir, one patient a day, and who is spending at least ₹1,00,000 because 2 days I said.
Yes.
Which means you are losing 30 lakhs a month of revenue.
Yes, I always wanted to see a remedy for this. We are thinking But that is the main reason like we have approached you.
But you, at least you observed, sir. Many hospital owners, they don't even think of these things. They'll be drowned in their own practice. So normally in rural area, a surgeon like you have a hospital. You must be busy from 8 o'clock to 10 o'clock.
Yes.
Morning 8 to night 10. And maybe you will do 1 or 2 surgeries a day.
Yes, one surgery per day.
Minimum will happen, no?
Yes.
And remaining you do ward rounds and your whole day outpatient practice will be there. Madam also will be busy there. So what happens is the hospital owners, most of the times, they are busy in their own practice, they are drowned in that. But more than what they earn by their own practice, equivalent amount is something which is lost like this. They don't actually recognize that. I am happy that you recognized it. See, even if you say you charge half of it,
Okay.
in your place, because you want to serve people, you don't charge equal to what city charges. If they charge per day 50,000 rupees, maybe your billing will be, take it 20,000 rupees. Maybe you charge in your ICU only 5,000 rupees. Lab, pharmacy, other things put together may cost you around 15 to 20,000 rupees. Even if you say your patient actually incurs, okay, 20,000 rupees a day, and 2 days is 40,000 rupees, which means you are actually losing 12 lakhs of business a month, isn't it?
You're right. You're right. Absolutely right.
And sir, I don't need to tell you on this. We actually calculated only on the ICU part. Okay, the moment you say that you have an ICU, more number of footfalls come to emergency. No, now
Yes.
people know.
Yes.
They come, and the amount of people that an ICU can capture, ICU team can capture will be more. No, now the emergency revenue will add to you, and the patient who has been in the ICU will definitely go to ward. No,
Board.
and according to the statistics, whatever the ICU revenue, at least half of it is charged in the ward after they come to ward,
Right, sir.
which is around 6 lakhs more, sir. So 18 lakhs, sir. So this is the revenue, not just you, sir. This problem is there with approximately 50,000 hospitals in India.
Okay.
Because if you go to the statistics, the number of hospitals that have less than 100 beds in India is approximately 50,000.
Oh.
Take everywhere. We have around 5,000 taluks in India. Each taluk and nearby surrounding places, you will have 5 to 6 hospitals, less than 100 beds. District headquarters, you will have every district headquarter, you will have 10 hospitals like that.
Okay.
And in go to city like Chennai, or even the second level cities in Tamil Nadu, you can say Coimbatore, Salem, Erode, things like that. In Andhra, you can say Vijayawada, Kurnool, Visakhapatnam, like that. You will have at least 50 hospitals like that. So approximately on total, there are around 50,000 hospitals which are ranging between 20 beds to 100 beds, and they all go through the same problem, sir. They are referring out their own patients to nearby corporate hospitals where they lose business, and they struggle to build upon that. One of the main reasons is lack of ICU.
Exactly.
They are aware of that, but they are not consciously aware of that. When there is no ICU, you can't take sicker cases. No, you tell me you are a surgeon.
Yes.
Can your anesthetist take a borderline sick case for surgery
No.
when there is no ICU?
Yes.
The same problem in and around you, there may be, do you have at least 4 or 5 surgeons in and around?
Yes, sir. Yes.
There, no? The same problem they will also be facing, no?
Also.
They may not have hospitals, there may be freelancers who will be going around. But once one hospital has an ICU, they tend to put their own patients there, they do surgeries there. What about the revenue from that? So these are all uncalculated revenues. You see only ICU revenue actually. But if you add all these things, you will be stunned to know that at least 20 to 30 lakhs of revenue is being lost already, which can be gained once a person gets ICU.
Exactly, as you said, after you saying like it is going in my mind, I am referring to somebody else. Like if I get ICU in my hospital, people start referring to them to my hospital also, right?
Good.
Also, as you said, like once the patient moves to the ward, then I am losing that revenue also.
Correct.
Thank you so much, sir.
Good, good. This is what for last decade we have been doing research into, sir, to come out with a model.